Hey everyone, welcome to our dental podcast by Slice of Healthcare. I'm your host, Jared Taylor. Joining me today is Chris Salierno, the Chief Dental Officer of Tend. How's it going?
I'm great, Jared. How you doing?
I'm doing well. Let's dive right in. Tell the audience a little bit about your background.
Sure. So I'm a general dentist. I graduated about 20 years ago and did what most general dentists do, associated in other dental practices. I started my own practice in 2010 and took on some other fun opportunities. I was chief editor of a magazine called Dental Economics, did that for 7 years. A great privilege to be working with that publication. And gosh, in 2020, I was approached by the executive team at 10 to come on as their first chief dental officer. And I thought, gosh, I'd sell my practice and give up all these fun things I'm doing to take on this responsibility. That's really exciting. But as I dug in and learned more about what they were working on, I said, okay, I can't pass this up.
Talk us through, for those that, I'm sure a lot of people are familiar with Tend at this point, but like talk us through for the people that maybe aren't. What is Tend, and kind of tell us about kind of the approach that you're all taking.
Tend is a full scope dental practice, right? So offering hygiene services, general dentistry, and we have some specialists that rotate through, right? Like oral surgery and orthodontics. We're located in urban markets. So we serve 5 different markets: New York City, Boston, Atlanta, the DC region, and Nashville. And so what we're doing there is opening brand new practices. A lot of group practices expand by acquiring existing practices, kind of folding them in, sometimes retaining the branding, sometimes changing the branding. Every Tend location is a de novo, is totally built from scratch. That allows us to create this curated experience for our patients. We refer to them as members. That patient journey, that member journey, is critical for us. From the first time they interact with our brand, booking an appointment, verifying insurance, all of those steps we want to be really special and unique and remove those common pain points. And the best way we know how to do that is to start each practice from scratch.
Yeah, it's. I mean, it becomes apparent when people just even go to your website and they see what one of your centers, one of your locations looks like. Totally different than your typical dental office, which, um, most resemble. No one wants to go to the doctor, and most dental offices resemble, the waiting room for a doctor's office, and um, you seem like you've taken a much more like calming approach too. Like it doesn't look like, everyone go to the site if you haven't seen it, like go check out or go to one of their locations if you're nearby, because it's I just love the approach that you've taken, because I have you talk with a lot of people in the that everyone's gone to a dentist and no one has had a really great experience with um, with whoever they're going to. Why has that been such a, I guess, a space that has not changed much before kind of 10 came along?
It's a very fragmented industry, dentistry. The vast majority of dental practices are independently owned. And I was one of those independent owners for a long time, for about 11 years. And so, with independent ownership, with a fragmented industry, especially in urban markets, you see varying experiences. We've also gone through, over the past 20 years, I would call it an industrial revolution, certainly in healthcare and certainly in dentistry, as we find digital workflows for patient intake and even for the clinical work, right? We can use intraoral scanners now instead of goopy impression material. There's dozens and dozens of major evolution steps forward in technology. And it's been piecemeal how dental practices have taken that on. And so you can get a very different experience, not necessarily a positive one, as you go from one dental practice to the next. I think there's also there's great benefit that we have from having a cluster of practices, a network effect in an urban area. If we have a provider that's taking a time off, we're able to quickly staff that position with one of our other trained doctors rather than rely upon a retired dentist to come in and mind your hygiene exam. So that network effect allows us to maintain continuity of experience as we often see our members want. Heck, in an urban location, we even have folks who say live in Williamsburg, work on Wall Street, and maybe they go on frequent trips to Boston. Well, we got them covered. You want to get your hygiene visit in Williamsburg? We got you. That's what works for your schedule, your busy schedule. And instead, if you want to go get your hygiene visit done in Wall Street, we got you there, right? We have your chart. We use cloud based software. We're able to track your data in all of those locations and give you a seamless experience.
Have you seen that be like part of your group of people that you're addressing, the people that are traveling? And it's always a pain to make a booking for, even if it's just a basic cleaning, right? So you're kind of saying we're there wherever you are, and in a nice calming way. Are you seeing many travelers to date?
We do. What's very common is a member that will switch from one of our studios to another, maybe temporarily, just because it's what's available for them and where they're located. Again, work versus home. We see a lot of that. But the jet setters, we do see that. We've seen New York patients that move to Boston or to DC, and they say, "Great, I'm glad I don't have to find a new dentist. We've got a 10 there as well."
Can you talk me through, because I first got connected with you and your team through Cedar, and I know you have a new partnership with them.
Yeah.
Can you talk me through what that partnership is, and for those that maybe are unaware of it, and how it'll continue to help drive you guys forward?
Financial transparency is really important to us, and that could be a challenge when we deal with third-party carriers. They're good partners, but it's can be a complicated process to really communicate with a patient what they're going to owe to get this service done. So we do everything we can to make that as transparent as possible, and we appreciate our partnerships with third-party carriers. But look, at the end of the day, we also need to be able to share payment options with our patients, with our members, and that's, I think, more important today than ever before. Pick your economic headwind from the newspapers these days, right? But being able to afford care, to find ways to pay for care is more important than ever before. So Cedar's been wonderful for us to just automate this process. That outreach to patients, to our members, is has been traditionally very manual. And just because we're a group practice, it's still very manual for us unless we partner with the technology solve like what Cedar's offering.
Now you have a bunch of locations now, so congratulations on all the growth so far. Are there any particular areas, and I know sometimes you might not be able to say something, but that you intend on growing into as well that you're not in today?
Yeah, so we'll look to expand beyond our current markets. We have our eyes on New Jersey. That's very closely located to New York, where we have tremendous success. This year, we're going to grow in more locations in New York. We'll expand into Queens, and we'll be expanding beyond in Boston. Boston's been very successful for us. As we look into the future, keep an eye on an east, starting in the East Coast and expanding westward, looking at those major metropolitan areas that are typically underserved by group practices.
And why is that? Why are they? Because you're right. When you go to these, even I'm in St. Petersburg, Florida, right? And you look, we don't have in the downtown area, like in our downtown area, many options at all. Maybe one, and it's very hard to find it, and it looks like it's maybe part of a convenience store or something like that. Um, why is it so difficult to find like good dental care in that downtown area in most cities?
There's tremendous, really talented dentists in urban locations, to be sure. I think it's interesting that group practices have generally stayed away from urban areas. And in dentistry, we call them DSOs, or dental service organizations. Large group practices largely stayed away from urban markets in general. Look, the modern form of a group practice, a dental service organization, really started in the 90s. Your Heartlands, your Aspens, Pacific Dental Services, those are the three biggest players in the space today. And I think in those early days, in the 90s, the 2000s, that expansion was very successful in more on the suburban and rural side of the spectrum. They would go into a market, there's maybe a handful of dentists, and the classic model for a lot of private practice dentists was, maybe they didn't take any insurance. Their hours of operation weren't very flexible. They didn't work Saturdays or evening or early morning hours. And so these practices would come in, maybe acquire one of those, or open up a brand new practice. And they had flexible hours of operation. They had Saturday hours. They participated with PPOs or other forms of insurance, and they did really well doing that. When you look at an urban market, there's so much inherent competition, and I mean competition from a business standpoint. In dentistry and in healthcare, we're colleagues, of course, but there's so much competition in an urban market. People have already figured out, I'm going to work Saturdays. I'm going to have evening hours at least once a week. I'm going to participate with PPOs. So that playbook's already done. And so for a group practice and to make a major push in an urban area, they have to be doing something else. And for 10, that's been focusing on our target demographics and creating that curated special experience where we merge healthcare with hospitality and give them that differentiated, unique value proposition. And that's worked really well for us.
Why is it so important to start from scratch? Because you do see, like you were saying, the common playbook was to acquire an existing practice, maybe make some improvements, but kind of keep it how it was currently running and just add it to the network of places. Why is it so important to start from scratch? Is it all about crafting the best like patient experience?
It is. I'd say one is the tech stack. So certainly you move into a practice, you want to have the similar aesthetics. Each of our tens looks familiar, feels familiar, but also has the same tech stack, right? So we're making sure it's practice management software that's compatible with our app, that's compatible with our intraoral scanners. We use iTero from the Align company. All of that technology just works seamlessly with each other. And if we were to acquire a practice, we'd have to overhaul all of that technology right out of the gate. So that's part of it. But it's exactly what you said. We want to have a fresh team. Many of our providers actually have had years of experience in other practices, but we want that fresh, clean slate, with setting expectations on what it means to bring a higher level of hospitality to dentistry. It's more than just being nice to people. We have a culture of excellence, of being able to receive feedback from our patients, from our members. We use Net Promoter Score. We're getting feedback from our patients routinely, and we do something with that. It's actionable, right? We sit down and reflect on how we can take better care of our members. So bringing that highest level of hospitality, having a culture that's open to feedback, it takes a team working really well together and being in line with that vision. And so we find the best way to do that is to start with a fresh team.
What made you want to go into the dental space from the start?
My dad is a happily retired orthodontist. My uncle is a happily retired endodontist. And I saw it was just an amazing opportunity in healthcare to still work with your hands, right, and be hands-on with providing clinical care, which was important to me. But what I was also excited by is you could still be an independent practice owner. I think that's really exciting. While I now work with a group practice, there still are a lot of private practice dentists out there, and in general, they're doing well, right? It's wonderful that you have that as an opportunity, but it's also great to see group practice thrive, and when they're offering a differentiated experience, a unique value proposition, that they're doing really well. So there's so many potential ways to be a dentist, just like in nursing. I mean, my gosh, how many? If you're a nurse, there are so many opportunities available to you, and I think the same is true in dental care.
So you had a bunch of people in your family so you were, I don't want to say destined because it was your choice, but it was I once had someone say they had they had this job and they called themselves a legacy because all of their
Yeah.
parents did it too. And I was like, I don't think that works though in other space. It's still your decision. You didn't have to go into the what I guess what along the way was the best piece of advice you had early on in your career? Because we have some people that listen to this that are maybe just starting out their career in the dental space as well. What actually, let's switch it. What piece of advice would you give to them or anyone starting out in this industry day one?
Starting out in dentistry, if you're applying to dental school and you're starting your first years in dental school, you're going to learn the human body. You're going to be essentially in medical school for the first 2 years of that program, and then you switch over to learning patient care. What I would say is pay attention to the human beings that are connected to the teeth that you're working on. It's, of course, very easy in dental school to be focused on the tooth carpentry, if you will, and be very focused on learning how to do that to a certain standard. And you certainly should. But pay attention early on to the human beings that you're working with as well, and develop those soft skills while you're also developing those hard skills.
Great advice. Thanks for sharing.
Really important in dentistry too. I mean, so much of what we do is very personal. We are invading people's personal spaces on a daily basis. I mean, you think about the relationship you have with your dentist, your hygienist. It is a little different than the relationship we can have with other healthcare providers. So you can be a ridiculously talented dentist or hygienist with incredible hand skills, but if your soft skills aren't there, it's going to be a tough road.
And I think just also how it combines to overall health, right? Like even you're seeing at all conferences, like a straight up healthcare conference has now having that oral health area because oral health is overall health, right? It impacts every facet of it. So it's super interesting that it's. I don't want to say that it's finally getting its due because it's always been there, but I feel like dentistry and dental health like that is becoming more of a conversation even in the medical community on the other end too, which is exciting. um, as we wrap up here, last question: what's next for the company that you're excited about?
We're excited to ramp up growth. We'll open 5 studios this year at least. Depends on how leases come together in urban markets. As you can imagine, that's exciting, but we've got a great team. And we'll look to open 10 next year, again, at least 10. We're excited to get back to some serious growth in our urban markets. And that's super exciting for our providers too. They appreciate having more colleagues join in growing that network effect in each of our locations. There's not 50 miles between 10 practices. There's a couple subway stops, and it's really exciting for even our existing teams when we open up some new doors. So that's where we're focused right now, and we can't wait to get started.
Well, I'm excited to stay in touch and continue to follow along the growth. Congrats on everything so far, and wishing you all the best of luck.
Cheers. Thanks, Jared.